Hello, everyone, and thank you for joining the 13th webinar in our Pandemics and Society series. Today's event is Pandemic Accord, Partial Failure or Partial Success. Today, we will be discussing the Pandemic Accord and the challenges that have come in trying to build a strong accord that all countries will agree to. We will also discuss the potential benefits that still remain in the accord and how it may shape future pandemic preparedness and response. I'll now pass it to our moderator today, Wilmot James, Senior Advisor to the Pandemic Center and a Professor of the Practice, to begin today's conversation.
So, hello to everybody globally, and we are hosting the seminar at the School of Public Health at the Pandemic Center at Brown University in Providence. So welcome to everybody to this discussion. So as you know, under the authority of the WHO, the Pandemic Accord, or what became known as the Pandemic Accord, began a drafting process in late 2022 and came, as we witnessed, to identify the gaps in our global health security architecture and the strategic and operational structures during the COVID-19 pandemic. It is intended, this accord, to be a binding treaty in which all 194 member states of the World Health Organization agree to uphold the clauses in the accord which are meant to strengthen global health security in advance of and preparation for the next pandemic, which will come at some point. And to help us think through the challenges that we've seen so far and the road ahead, we are fortunate to be joined by three of my esteemed colleagues. Firstly, Nina Schwalbe, who is with Spark Street Advisors. She's also an adjunct assistant professor at the Columbia University's Mailman School of Public Health. Nina served as the acting director and program division and chief of health for UNICEF, implementing health-related programs in over 150 countries. Also, welcome to Sultani Hadley Matendechero, who is with the Ministry of Health in Kenya, and where he is a consultant clinical pharmacist and head of the division of vector-borne and neglected tropical diseases. He's a chairperson of the African Neglected Tropical Diseases Program, manages community of practice, and works for the East Africa Platform Advisory Committee. And then from Peru, Ernesto Gozzer, associate professor at the University in Peru, and he has over 25 years of experience in public health, helping in both the public and private sector in more than 20 countries. So thank you very much again for joining us today. Before we start, I want everyone to be candid and to jump in when you agree or disagree with one another during this learning exercise. But to get us all on the same page, we have the real honor and pleasure of hearing from Nina, who will give a short briefing on what the status is of the negotiations presently happening in Geneva with regards to the accord. So over to you, Nina, and we know you need to load some slides.
Great, thank you so much. Let me just jump on in and show my slides. Are you seeing my slides now?
Yes, we are.
Perfect. All right, well, thank you so much for inviting me. I'm really honored to be part of this seminar and to join colleagues at Brown, an institution for which I have tremendous respect. So I'm going to give you a little bit of an update or state of play on the pandemic agreement. As Wilmot mentioned, there were really three different parts to the story of coming together on the idea of a pandemic agreement. There was a high-level meeting last year, which was supposed to get heads of state commitment and momentum to doing something differently. So we didn't repeat the COVID experience. There's the working group on the international health regulations, which was about amending regulations that have been in place for a long time, last time amended in 2005, which are kind of the nuts and bolts roadmap of what member states are supposed to do to be able to call a public health emergency of international concern, and then what they do once they've identified, and then what are the very concrete steps that they need to do in terms of a response. And this treaty was supposed to be something different, and it was supposed to strengthen, if you think of IHR, more about what countries are supposed to do themselves. This treaty was supposed to bring global momentum to how states work together better and really operationalize equity. As you all know, the response, particularly around allocation of counter members, was seen as incredibly inequitable during the COVID-19 response. The intergovernmental negotiating body, that's another way of saying all the member states that Wilmot just talked about. And that is the body made up of member states, every one of them of the World Health Assembly that is supposed to be negotiating the treaty. It was a long process. It was called for in November of 2020, so quite soon, within the first year of COVID-19, but it took a while to get to this so-called zero draft. And for those of you that are less familiar with UN speak, zero draft means we're just putting stuff on paper, but we're not really ready to discuss it yet. So this is a zero draft. And I think one thing that I'll talk about a little bit today is that draft is not yet a negotiating draft. So there were working groups established that put together some text. Text was considered, different groups met to put together a document. So the first negotiating draft really only came out in March of this year. It was supposed to come out in October of last year, but it really only came out in March, which essentially gave member states March, April, May, 3 months to negotiate an agreement. And that text, when it first came out, was about 23 pages. It ballooned over the course of that meeting to over 100 pages. So it's a lot of negotiating, and it's really about negotiating word for word. This is where they landed in terms of this March draft, and this slide gives you an idea of all the different issues that were under discussion, from supply chain and logistics to financing to surveillance, and then governance as well of how this agreement would be governed. So for those of you, again, that have had less experience in the UN process, there's something called greening, yellowing, and bracketing of text. So greening means they get in the room, they've discussed in their subgroups, they get in the room, and this is all the member states meeting together in plenary, and they say, green, it's a go, we're agreed. And one of the first paragraphs to get agreed in green of this pandemic accord was, WHO will not be in your living rooms. And I think this was really to speak to sort of the disinformation about what this treaty would mean for national sovereignty. Okay, so they agree in green. Yellow means outside the room in the working groups. States that have disagreed about language have come to enough of a proposal that they want to bring it forward to the full group for voting. Or for consensus discussion. And then there are brackets, and brackets means that they're not yet agreed on a particular word. They're still debating whether or not that word is appropriate, should it be in or out. And then finally, there's text where they haven't yet come to any agreement. As of this morning, actually as of just now, there's still over 100 paragraphs yet to be discussed and agreed. There are over 100 that have been agreed. So that's the glass half full side, but there are over 100 yet to be agreed. That's the glass half empty. So what are the sticky issues around the agreement? I'll just talk about a few of them because we'll get into that into more detail as we go along. One Health is the idea of planetary health. It's about people's, animals, and environment. And the disagreement here is that high-income countries are primarily asking low-income countries to put in place surveillance systems, and low-income countries are saying we don't have the financing. So unless that comes with financing, we can't make promises to which we can be held accountable. Another issue there is One Health really solely in the remit of a treaty that would be covered under WHO, because it also involves the Food and Agriculture Organization, the FAO. It also involves the UN agency that deals with animal health. So that's one set of tricky issues. The next one I'll talk about is the pathogen access and benefit sharing. And I think this was best described by a colleague. I'm sure many of you have read that book about Henrietta Lacks and this idea that people provide, or in that system in Johns Hopkins, this woman, her genetic material was taken, it was used to benefit science for decades, but she got no benefit from that. So the question here is, if low and middle income countries give access to pathogens, genomic sequencing, like was done in COVID with the Omicron variant by South Africa, what will the benefits that they will get back from them? And what they're asking for is particular, not only open science and access to the science derived from those benefits, but also actually to products, vaccines, diagnostics, and drugs. And the sort of final big issue is financing. And there's a lot of promises that people are making, and will it come with financing, particularly for low and middle income countries. Over the course of the last couple of months, or really almost since the beginning, groups have more or less coalesced in different negotiating, I don't want to say factions, but blocks. The Group for Equity is the group of countries here. It's a mix of G77 countries. The Africa group, this was very exciting for people because Africa came across really from Tunisia to South Africa as one group arguing together for the principles of equity. There is also a group called the Anti-Sanction Group. These are groups like Iran and Iraq and Russia who say, during the times of pandemics, if there are economic sanctions on us, we don't want to be exempt from ability to receive pandemic countermeasures. High-income countries were also arguing together as a bloc. And then there were manufacturing countries. And this was interesting because this is where there was some divergence of what you'd expect. So clearly, the pharmaceutical industries were very important in the sort of bloc mentality for the high-income countries. But then there were countries, Bangladesh has a strong drug manufacturing constituency, Indonesia, India, Brazil. So some countries that you wouldn't expect necessarily on some issues around, particularly around pathogen access and benefit sharing, were siding more with the high income manufacturing countries. So just what's next? So it's Thursday afternoon, and there are a couple of options. They still have 100 paragraphs to go. We were just told they'd be working well into the night to negotiate this agreement. So one option is they take the green, if they've got enough green, and they put it to the World Health Assembly, and they approve it as that. And then it still has to go through ratification by member states to come into force. We can talk about that sort of detail later. So one option is they put it to the WHA, the green parts, WHA says go, and then the ratification process begins. The other is they say, we didn't quite get there enough. Here's the yellow-green bracket. WHA, you decide what comes next. And WHA says either let's continue the process and in 2 months or 6 months come back together, or they say we've had enough, let's stop. In terms of, I think as academics, we start to do a lot of thinking about what went wrong, both in terms of process and content. And I won't go through these slides, but I think this slide is intended to say that I think there would be agreement at the end that there was a lot of things that could have been different in terms of process. And probably the most salient is the fact that the draft only came out in March and states were only given 3 months to negotiate a very complex treaty was not enough time. The second on the content, and we don't yet have access to the final draft. We've seen bits and pieces leak through various organizations, but the focus on pathogen access and benefit sharing as sort of the key issue, and the co-chairs kept saying of the process, nothing is agreed until everything is agreed. So I joked a little bit with my students that it's like they started at A in the alphabet every time they had the discussion, and they never got to other issues. So a lot was left till the end and really didn't get proper airtime. But a lot of things have really been left out of this agreement. And I think for me, the most sort of tragic of that is all of society, all of government, that this is very much still a sort of WHO agreement. So that's where I'll end it in terms of overview. Oh, did I just leave the meeting? No, good. I just stopped sharing. Excellent. So that's where I'll leave it. Thank you very much.
No, thank you very much, Nina. So colleagues, just to say you got the state-of-the-art update on where we are. And just to remind everybody what the stakes are here. Coming out of COVID-19, we all, certainly in the public health and related community, believe very strongly that we have to tackle pandemics and epidemics very differently compared to what we've done in the past. And we also believe that it's possible to do it differently. A treaty like this, or an accord like this, by the WHO means that the WHO is a normative organization, is that we need to redefine the norms at the highest level when it comes to 3 priority issues: to train the next generation of health professionals and to network them globally, to strengthen our surveillance systems, and to decentralize the production and manufacturing of medical countermeasures, and particularly vaccines, and then to finance it in a manner that promotes equity and access. That's what's at stake here. And so those are the big issues. And I thank Nina for walking us through the details of what happens in the negotiation process. So I'd like on that basis then to turn, first of all, to Ernesto, and to ask Ernesto to share with us his perspective on what this means, and in particular with a focus on what this means for that part of the development world that he is most closely associated with, which is South America. So over to you, Ernesto.
Thank you to the Pandemic Center for the invitation, and thank you to you, Wilmot, for the introduction, and Nina for this very informative and very well done overview. And yeah, she put all most of the issues that are very important for South America, Latin America, and South America, and the global South to be more accurate. I want to talk a little bit about the technology transfer and why it is important for us. No, we in the region, we have some countries that have a capacity for production, research and production, and also for level 4 regulatory bodies. No, but what we need to put this in place, and during a pandemic, or even we would like to also to see there to have these provisions also for public health emergency of events of international importance. So what we need is not only to have the article and the provisions, but also we need funding to improve the capacity. We need to exchange for improve the research capacity. And we also need to have the capacity, I mean, not only us, but the Global South, to have the capacity to use the TRIPS flexibility. TRIPS flexibility are the provisions in the World Trade Organization that allows the countries to suspend for some time the patent of the product. So we need this and we need to update these provisions, these TRIPS. This is the moment for us to have also an update version of the TRIPS that allow us to be really able to use that flexibility, because they were in place during the pandemic, but we couldn't use them. This is one thing I wanted to say. I don't know if I have time, or maybe in the next round.
I think that's great. It's a fundamentally important question about promoting access to technology that's necessary for medical countermeasure production, manufacturing, and R&D. And that in many ways is at the heart of what needs to happen in order to empower countries with that technology in order to prevent the kind of shortage of vaccine distribution, for example, during COVID-19. So key. If I can turn next to Sultani with the same question, is what from his point of view, what is the perspective that he'd like to present from the African continent, or from Kenya in particular as a country? Over to you, Sultani.
Yeah, thank you very much, James. For me, I just wanted to very quickly give a little bit of perspective, just to strengthen what has already been said around the rationale behind the ongoing process. So first of all, I just wanted to say that the two processes that are going on that are mutually reinforcing, that is the Intergovernmental Negotiating Body seeking to negotiate a new pandemic accord, and the working group on amendments to the international health regulations are mutually reinforcing. And these were a product of the 75th World Health Assembly that happened 2 years ago in 2022. So far, we've had 9 meetings of the INV, with some of the meetings having several resumed sessions, and 8 meetings of the WGIHR, that is the working group on amendments to the international health regulations. So very quickly, the rationale was that the COVID-19 pandemic exposed a lot of gaps in the implementation and compliance to the international health regulations, which is the document that essentially is supposed to help mitigate this international spread of disease without really interfering with travel and trade. Now, we realized that during COVID, some countries were not providing data, they were not they were not implementing the international health regulations. So this was one of the issues that the 75th World Health Assembly actually looked at and said we need to now establish a body that can give us an international law, which will now make the implementation of the IHR more obligatory as opposed to discretionary as it was before the COVID-19 pandemic. The second issue that came out very clearly during the COVID-19 pandemic was the issue of equity. So there was a lot of inequity in terms of access to countermeasures, which has already been said. I'll not overemphasize that. And that was one of the issues that we were trying to see how we can be able to address with the 2 processes. Of course, the third issue was that the IHR was last, it was reviewed in 2005. There has been a lot in terms of capacity building, and we needed to review the IHR so that we make it more fit for purpose, in preparation for the next pandemic. So the outcomes, the issues that have arisen during the negotiations, very quickly, the global South countries, because now for compliance to happen, for the implementation of IHR to be mandatory, then it means that there are a lot of core capacities that need to be put in place. And some of these countries which have a very fragile economies do not have, that is not a priority because they are struggling even to just have their populations to get the basics like food and health. So they have called on a financing framework which can enable them to put the core capacities in place for them to be able to implement the IHR in an obligatory manner. The second issue that has arisen is the issue of governance, because now if we are to monitor compliance and implementation, then we need to have a governance system. The Global South prefers a conference of parties where we have a committee, an implementation committee that comprises of all the 196 states parties. But most, you'll find that more like the Global North tends to believe that this is a very expensive strategy and we'd rather use the resources to implement rather than to maintain a very big committee, so that we just have a small committee of experts to enforce implementation. Now, the other issue is around equity. So to enable equity, the Global South feels that if we can build capacity for local manufacturing of countermeasures, local production within the Global South, it will be easier to access these countermeasures when pandemics strike. And so that calls for capacity building, so a better manufacturing capacity in the Global South, and it directly translates to support from the Global North. It calls for tech transfer, which the Global South wishes to have unhindered mandatory tech transfer, but the Global North wishes to have voluntary tech transfer on mutually agreed terms. So that is a bone of contention. You can see that it is said that we still have about 100 paragraphs to go. The other issue is around the pandemic access benefits and sharing. So whereas the Global South feel that they have produced a lot of data, a lot of information in a mandatory situation where they have to give this data, they have to give this information. Sometimes it is information like, on genomic sequencing. Sometimes it involves even giving samples, biological samples, and even pathogens, which can be used to develop, to come up with innovations that will end up being sold and the benefits do not trickle down back to the countries that have provided the data. They need to have a framework where some of the benefits that accrue from this information can come back to the global south. And of course, the global north is opposed to that. Now, very quickly, there's the issue of, IP, the intellectual property rights and patents, which has been touched on. I really don't want to go back into that. So, of course, there's also a bit of polarity around IPR waivers. The global south wishes to have the intellectual properties rights waived and patents so that it can make it easy for these countermeasures to be accessible. And for purposes of targeted amendments of the IHR, there are two issues which are also cropping up. Number one, there are definitions which are creating a little bit of suspicion. Like, for example, the introduction of terminology like early action alerts, which the global north wishes to introduce so that we can have an alert which is declared before a fake is declared. That is a public health emergency of international concern. We have a pre-alert, but the global south reads mischief in that. And then, of course, the introduction of One Health, an article that now provides for One Health. That is, apart from human health, we want to provide for animal health, because animal health also plays a big role in pandemics. We also want to look at environmental health and even plant health. So the argument from the global south is that there are bodies that are already in existence, which are taking care of these buckets of animal health, environmental health, plant health, which can be better coordinated instead of struggling to include this article in the currently ongoing negotiations, because already we are not able to take care of human health alone. So I want to pause at that point because of time, so that if there are any other issues, then we can come back to them. Thank you, and back to you, James.
No, thank you very much, Sultani. That was a really very good overview of what the core issues are, certainly for the developing world as a whole, and which, of course, Africa is part of that. So, and it has to do with benefit sharing. It has to do with those hot button issues, right? Benefit sharing, data sharing, IP transfer, all of those well-defined mechanisms that are involved in developing a political economy of response to pandemics. And so thanks for framing it. The question is, are we going to get it or not? And if we don't get it, and we get, it sounds like a much weaker system, then we will not have that kind of international norm that's required to provide a blanket umbrella mechanism for enforcing, or at least strengthening adherence to a revised set of IHR principles. So I'm going to now turn back to Nina. She has given us a presentation on what the lay of the land is, but I'd like now her view about the likelihood of getting agreements on those core questions around data sharing and around IP transfer. So over back to you, Nina.
Yeah, it's a little bit of a crystal ball to be able to do that, because they really, I mean, as Precious Matsoso, who's one of the co-chairs, said about an hour ago, they're going to stay up all night and try to get there. And so I wish them well in that endeavor to try to get there. There's one thing I'd just like to comment on that's been a real disappointment in the drafts that we have so far, is this idea of compliance. Because unfortunately, in both the IHR language, that language was significantly weakened. And in the pandemic accord language currently, and this is part that's already been green, there's no compliance. There's also no implementation committee. That's all to be left later to a conference of parties. So I think, unfortunately, this issue, and I think this applies almost more, from my perspective, applies more to the global north than the global south, is you have countries, you're pushing hard to get countries to sign up to agreements, and will they be accountable for those agreements? So that's a real loss. I think the other thing that has put a bit of a negative spin in a way, and unfortunately, I think the idea that these were going to be mutually enforcing processes was an excellent one. I think how that played out a bit, though, was that they ended up competing for time. They were both trickier than people thought. They ended up competing for limited time, and that was particularly tough for smaller delegations. They were both negotiated in Geneva. And so people were stretched, negotiators were stretched. And right now we're in a situation, today we're in a situation where IHR could not be agreed because they were waiting for parts of the pandemic agreement to be agreed. And the pandemic agreement is waiting for terms and definitions to come from the IHR. So they're a little bit stuck. From my perspective, the question is, if I had to hold a crystal ball right now, I don't see how they're even going to get to a reasonable green text by Saturday, which is really by when it would have to happen, or by, I think that the discussion is scheduled for Tuesday. There'll be a ministers' meeting on Sunday. They're really trying, so they're extending the days even further than tomorrow. The question that I have, and I'd be curious in the other panelists' reaction, is, will this hold up the IHR? What does this mean for the IHR? Which I think people thought was much further along in terms of agreement, getting to yes, and some really meaningful changes. Thank you.
Thanks very much, Nina. So I'm going to throw that question back to Sultani and then turn to Ernesto for a response. The question is, of course, what's the implication for strengthening the IHR, which you've heard? So back to you, Sultani.
Yeah, so of course, I want to really just I also underscore the concerns that Nina has brought about. And the intention is that these documents will be presented to the World Health Assembly next week. Of course, the IHR is much more advanced in terms of nearing completion. The areas of contention have really trickled down to just about 3 or 4 areas. Most of the other areas have been agreed. Remember, the IHR is already existing. And what the WHO mandated the working group to do was just to do some, to bring in some targeted amendments to make it better. So it is a document that is already in existence, and it is possible to just give a package of the areas that have already been agreed upon, so that they can improve on what was already in existence. Now, there is an attempt to, because probably, the INB is moving a bit slower, there is a little bit of frustration that is setting in, and it has been observed that some member states seem to be leaning towards an attempt to try and load some of the provisions, because these two processes are really closely related. So to try and accommodate some of the provisions within the IHR. But the thrust at this point is that both processes should be completed, and there is a lot of optimism that there can be extension. As you have heard Nina say, it is not the first time that this will even go into the morning. We have had negotiations going into the early morning, and all the avenues will be utilized to ensure that next week we have something to be presented to the WHO. Now, whereas we say that the draft was presented for the INB was presented just a few months ago, negotiations have been ongoing even before this draft was presented. So quite a bit has already gone into the draft that is being worked on. And the intention is that if we can be able to unlock some of the areas, then we can be able to see a domino effect and agree on a package that can be presented. So we are keeping our fingers crossed and hoping that next week we should be able to achieve the mandate that was given by the 75th World Health Assembly. Remember, the time frame that was given was 2 years, and so it has come to an end. There is an option of extension, but the thinking is that if we can be able to meet that objective in time so that we do it by next week, then the better. Thank you, and back to you.
Okay, thank you very much. Just to remind everybody on this webinar that when I believe it was the Obama administration looked at the level of compliance with the 2005 IHR, they found the level of compliance so low that together with a range of number of countries introduced the Global Health Security Agenda, which was an effort to create greater capacity that was measurable over time, when it came to the core capabilities for countries to respond to pandemics. That was introduced. So that's been ongoing. The financing around that is weakened. Now we're looking at the same thing. We've got a new IHR coming up, and the pandemic treaty is important, partly because of the capacity building that you were talking about, Sultani, but principally because it needs to solve the problem around benefit sharing, information sharing around pathogen and risks, and so on. So the key thing that has to be achieved by this treaty is to solve that problem in some way or the other. That's the nub of it. You can still then have capacity building programs that's by a renewed global health security agenda and other innovations. We've got a new pandemic fund that has been set up. So we made some contribution around the financing. We haven't completely solved the financing problem. But I just want to repeat, that's the key issue. It's about, there's a number of issues, but it's about benefit sharing in order to make it possible for countries to respond as a globe in solidarity against pandemic. I mean, I'm preaching to the converted when I say a pandemic is a global thing. It is not just a problem of the South or the North, it's a global thing, and therefore every country must be in a position to contribute to solving that problem. And that is what this accord must do. Otherwise, actually, it's not going to make much of a contribution. So over to you, Ernesto, your perspective on this. You need to, you're on mute, Ernesto.
I also hope to reach an agreement, but I am not so optimistic that they can make it this time. There are too many issues floating. But I think that they don't need to stick to the deadline. They can also set another special session that, like they did, to start this process. They start this process with a special session in December 2021, and they can do the same in this case because there are, I mean, the PAPs and the technology transfer and other issues that have been mentioned by both Nina and Islami. And I think that what we need to do is to be sure that, because this is a so important accord, treaty, that we need to be sure that the basics are in there. And then maybe others can join later, but we need an accord that really help us as a global village that we are now to prevent, detect, and respond the public health threats. And there are a very good experience so like the one you were explaining with the global health security agenda, and several outputs, several products that were in place that started from there, like the joint external evaluation that it can help the countries to start a process to analyze where they are and what they need. In some regions, there are some funding for implementing some of the needs that the gaps to reduce the gaps they are finding in these processes. And I hope that they reach an agreement, but I am not sure. And I hope this treaty, this accord will be something that is of mutual benefit, because we are all in the same ship. Over to you.
Thanks, Ernesto. I'd like to turn to a slightly different topic in terms of content. So pandemics are caused by novel pathogens that can originate naturally, but they can also be generated by accidents, and they can also be deliberately applied. And so accidental, deliberate, and naturally caused outbreaks is a concern. And it's a concern especially in the world where we now have the ability to synthetically produce pathogens, and we, with artificial intelligence, speed up, accelerate that process. So the question of biosecurity, which is to keep pathogens in safe hands, as it were, is a huge risk area. And so my question was, first to you, Nina, is how strong is the pandemic accord in terms of the biosecurity measures that are necessary to make sure that the threat of release is minimized?
I would like to do a word search for it after I answer this question. My sense is that if it's mentioned once and perhaps in the preamble, and maybe you've done a word search, but that is not a major focus of this agreement. But I hope maybe somebody can correct me, but I'm going to do a word search right now on the draft.
With 3 times.
And is it given its own paragraph with financing and any certainly hasn't been a major part of the debates or discussions, which one, as you raise it, would have thought it might have been.
So what I've learned is that some countries fought for stronger definitions and inclusion of that in part of the pandemic accord. And so, but it's impression that is actually quite weak, and that's a problem. For those of us who work within the biosecurity area, that is a problem. So, so the answer is that it actually is mentioned 3 times. And that I just wanted to flag as an issue. So, and so when you're dealing with production of vaccines and you're dealing with the production of medical countermeasures, must be sure to protect healthcare workers against the risk of exposure, but you also have to make sure that, you know, high consequence agents and toxins and pathogens don't fall into the wrong hands. So I just wanted to flag that particular issue.
And at least in the draft that I'm looking at, one of those times is in brackets.
So, so thank you. So let's imagine that what we get is a very weak agreement, and we need to then rely on other measures in order to advance the cause. And so the first question I have is that if we don't have an agreement over that core issue, or if it's weak, are there other parts of the pandemic treaty that are very strong and encouraging and important to strengthen in the course of time? So I wanted to ask Nina that question first of all.
I think people are pleased with the health workforce paragraph is the one that people continue to mention, that it does recognize the primacy of the health workforce, the need to have a strong, supported, and well-skilled workforce. I think that's one where people see it's a game changing. I think on the others, it's still the devil's in the detail as to where the brackets lay. There was a lot of weakening language. We call it comma as appropriate. There's a lot of weakening of the strength of the commitment, shall intend, shall endeavor to promote, as opposed to commitment. So I think until we see the final draft, it's really hard to know if this is going to make a difference. And I think there's some worry about that. Well, there is a worry so there's worry about pushing the process forward because of the change in government. I mean, even the UK has just called for a flash election. There's been a lot of pushback in the public opinion in the UK. So there's really a feeling, in sitting around the halls of WHO while these are being negotiated, that political will is waning, and the time, every second we lose is of detriment to reaching some sort of agreement. On the flip side, there's worry by a number of advocates that some of the language, as colleagues just talked about, this voluntary and mutually agreed terms, that it's called the double negative, the double weakening negative, and that if the language is too weak, it may actually be a setback to other international agreements. So I think the devil is in the detail, and seeing that final draft of exactly how the language plays out.
Thank you very much, Nina. To you, Sultani, can you address some of the issues to do with financing when it comes to what it is that the pandemic accord will enable, just given that there's been a change in the financing landscape, but to really make a difference in terms of diminishing inequality, greater access to medical countermeasures, we need new financing mechanisms, and that can be enabled by the pandemic treaty. Obviously, the pandemic treaty itself is not capable of actually lining up the architecture for finance.
Yeah, so thank you very much, Professor. The main bone of contention here is that there are already some financing initiatives that can be recruited to go towards supporting implementation and compliance to implementation of the IHR. But the feeling, especially from the global south, is that we have experienced from the existing financing mechanisms that sometimes they are tagged to other issues and they can be used to advance other interests, so that they are pegged on other requirements and not just purely available for the purpose of preparing for pandemics and responding. So that's why the countries in the global south really are clamoring for a completely new financing framework, which is devoid of any, no strings attached. It is just purely for pandemic preparedness and response, which is open for contribution from all the member states. And the member states with weaker economies can contribute less. The ones with stronger economies can contribute more, so that we have something that is aligned to the GDPs of the member states. Now, this resource basket can now be managed by an independent body like WHO or an equivalent that is just able to now disburse from that kitty according to the needs of the country. So, of course, we will have a situation which mirrors the common but differentiated responsibilities framework, where some of the countries that are putting in the list will actually end up drawing more, because our common problem is to prevent pandemics, to prepare for them as a global community. And someone correctly said that, for pandemics, no one is safe until all of us are safe. It's a global problem. So we are just putting into a kitty so that we protect all of us. But the global north insists that there is the pandemic fund, which should be used to now finance these core capacities. And that's where the bone of contention is coming from. Now, sometimes as bureau members, we have offered suggestions for a middle ground where we say, can we have a reformed pandemic fund which will take care of the fears from the global south, but then, we find that, this is a member states-driven process. And so the member states will be the ones which have the final say. And of course, they come back and say, no, it is not possible for us to reform the pandemic fund. What we need is a completely new fund. And that is where the stalemate lies, and I think we really have to keep on reminding the member states that this is not your usual, support between countries. This is a global action initiative where we really have to find a breakthrough so that we can now bring this accord into force and be able to utilize it to prevent the next pandemic. Remember, there's a lot of globalization now, and the next pandemic will come much, much sooner than we expect. So the faster we are able to do this, the better. So with the financing framework, generally, that is where we are stuck. And maybe just before I stop, the member states are really keen on a framework, a financing framework, which is accountable to the member states. I talked about this coordination mechanism, the governance, which involves a conference of parties. And the thinking is that this conference of parties can even have a bigger mandate in terms of also supporting operationalization or administration of this funding mechanism or financing mechanism. So that is generally where the issue is. And if we get the financing right, it is now possible that we can even leverage the financing to also deal with some of the difficulties that we are seeing around tech transfer, around IP waivers, around patent waivers, because one of the biggest arguments from the global north is that if we now start putting IP waivers, patent waiver, then we are going to kill research. How are we going to compensate the researchers who are innovating? So I think a robust financing framework can also start reducing the burden so that we can be able to find a way of compensating researchers and innovators. And then we reduce the argument around some of these requests around tech transfer, patent waivers, and IP waivers. Thank you, and back to you.
Thank you very much. So Nina's found the particular remaining language of it when it comes to biosecurity, which is very restrictive. It's about laboratory biological risk management. And biosecurity is much bigger than that as an area. So that's a very narrow, and that's a sort of an obvious commitment that should be really just quite strong. It should be green by now, but it really ought to go beyond that. So, but thanks for just pulling that out. Sultani, there's a question from the audience asking about the current limitations of the pandemic fund. But before you respond to that, I wanted to say that pandemic preparedness and response should be co-financed, right? So, countries are actors, they have balance sheets and they have budgets to spend, and they ought to spend a measurable component of what it is that is required for preparedness. So in my view, there are two things that's required to build trust in terms of guaranteeing that there's proper preparation. One is to have new financial instruments that are creatively applied, but also measurable contributions from governments of individual countries, because a lot of the underinvestment that happens is partly as a result of governments. So that was a question to you, Sultani, from the audience, and to highlight what the limitations are. Did you have any comments in this respect, Ernesto?
So, is
Go
it
ahead.
possible that I can just quickly respond to that? And maybe
Yeah.
just to paraphrase, because I had tried to touch on it. The worry is that learning from the previously existing financing mechanisms for even other initiatives, not just the pandemic preparedness, of course, this one is a new one, but looking at other initiatives like, say, the Global Fund or other funding support mechanisms, we have experienced situations where probably some countries, say, for example, enact certain laws, and the response is that support towards some of their programs is withdrawn, with regard to, to exert pressure, to just make sure that they conform to certain ways of thinking. Now, the current pandemic fund is set up in a manner that is very similar to the existing, those existing funds. And that's why I was saying the fear, what we are hearing from the Global South is the fear of this pandemic fund as it is being now utilized to advance those kind of strings attached kind of situation. So, because it's just a number of countries that are contributing to it, and the management is controlled. The administration of the fund is controlled by these few countries, and it can easily be abused, for lack of a better word, to try and advance other interests outside of the, pandemic preparedness and response. So that's why especially the countries from the Global South are looking at this as a limitation and saying, no, we want a new fund that all countries can contribute to, so that we remove that, leverage that the few contributors have that is existing in the pandemic fund, and then it is administered by an independent entity. And I gave the example of WHO just to ensure that it is completely supposed to support pandemic preparedness without any strings attached. That is the biggest fear. I hope it has come out a bit more clearly. Thank you.
Thank you very much. So, colleagues, we are running out of time, so I'm going to turn to the panelists for just a lightning round of closing comments. I want to just say that the WHO is the only global body that has a moral authority to act on the basis of the majority of the world's countries. They have the moral authority. They have limited capability. It's a normative agency and it's a technical support agency that has a budget that is smaller than some biomedical complexes in this world. And so, but that's the body we have, and therefore a convention or a treaty or an accord that has the moral authority of the WHO is the only basis in which we can actually piece together solidarity in terms of reacting to something that is a global existential threat, like a pandemic. So we want to wish the WHO well in its work, but also hope that there's a pandemic treaty that, in fact, would establish new norms for future work when it comes to responding to the pandemic. So with that sort of call to action and with all the limitations that we are facing here, to ask Ernesto and Nina and Sultani just to give a closing set of lightning comments. We've got 3 minutes to go, so 30 seconds each, please.
Okay, thank you, Wilmot. I think that as the negotiations are at this moment, I don't see that we can come up with a draft that can be approved in the World Health Assembly. But I hope they can manage to propose a new session in the near future, within 3 months or so, because making the balance, I think that we have made, I mean, the world has made a lot of progress with this, with the discussions for this accord, and we should finish this task because it's in the benefit of all of us. Thank you.
Thank
Over to you.
Yep. So I'm going to go back to Sultani and then end up with Nina.
So thank you very much, James, for putting this together. And I want to agree with Ernesto that a lot has been done. And, you know, like even for the IHR, it's very little that is remaining. And for the INB, a lot has been done in the background, which can result in a wave of green, you know, in the document. So what I could say is, although the time is limited, and we appreciate the concerns that are coming out in terms of whether this process can be concluded or not, I still want to say that the remaining time can be sufficient, and we are actually optimistic that it will be sufficient. What we really need to do is, as important stakeholders, let us advocate for those. You know, there are so many people who can be able to help us move towards consensus. Let us do what we can, what is within our ability. Let us talk to the people who can influence consensus around those areas that we have talked about, because we have agreed on everything else, so that we can now be able to move towards consensus. And if there's anything that anyone can do that will delay consensus, then we really need to also reach out to these kind of stakeholders and encourage them not to do that, so that we can move towards a conclusion. Thank you, and back to you.
Many thanks. Nina?
Yeah, as much as I appreciate getting somewhere is important, I think we have to be really careful not to let member states declare victory and walk away. I think in a best case scenario, this will be a least common denominator. This is consensus of the least common denominator. They have not tackled the hard issues, and at a best possible scenario, this is going to be a floor and not a ceiling vis-a-vis the ambition that people hoped. And I think I I just think we have to do a forensic analysis. As you know, as an epidemiologist, it would be hard to do a study of what went wrong here because there would be so many confounders in this study. But I do think we have to go back and really look at what went wrong in terms of process and content and where we didn't achieve and what needs to be done so that we can prevent the next pandemic. Thank you.
Thank you. And with that, let me just thank our panelists and everyone who joined us today for this discussion. I also like to thank my team at the Pandemic Center. We helped put this together. Bente Holt, Leah Lovgren, Carly Gasker, Amanda Kogan, Andy Ulig, and Aquel Person. If anybody would like to have access to the recording, it will, in fact, be available to you, as you can see. And with that, thank you very much for joining us for this last hour to talk about this really fundamentally important development in the world of advancing health and pandemic preparedness. And with that, please go well. Many thanks.